Good afternoon, students. In the previous videos, we learned about the Unit 1 and Unit 2, and that is the nutrition in childhood. Now, how to feed the sick child. So, this is the second part of the Unit 2. So, feeding in sick child. So, nutritional adequate diet is essential for the optimal growth. ग्रोथ डेवलपमेंट माइलस्टोन है, उसके लिए न्यूट्रिशनली एडिक्वेट डाइट इज वेरी इंपॉर्टेंट. सो देयर आर अप्रोप्रिएट डाइट एंड फिजिकल एक्टिविटी रिड्यूसेस द चांसेस ऑफ इन्फेक्शंस, reduces the risk of diet related chronic diseases in a later life, that is diabetes, hypertension. If you are giving nutrition from childhood very adequate and appropriate, then only that child doesn't have consequences of diabetes or other hypertensive diseases, obesity and the other nutritionally deficiency diseases. So the child need to eat more during and after the period of sickness. Usually what happens, children reduces their appetite during the acute illnesses. Fever आ गया, diarrhea हो गया, तो child उसका खाना stop कर देता है या फिर reduce कर देता है. But during and after fever consequences or the other deficiency diseases, child required more nutrition. So commonest diseases include in infancy are first the respiratory infections, gastrointestinal infection, which is the most common infections like constipation and diarrhea, and parasitic infections, and protein energy malnutrition. So nutritional deficiency occurs when body is not getting enough nutrients such as the vitamins and minerals, because the vitamins and minerals are the more protective foods which give protection against any infections and inflammation. So diet must be rich in vitamins and minerals. So next is, first commonest thing happen in India is malnutrition. That is a major health problem in the developing countries among the children younger than the 5 years also and below than the 5 years also usually. So first is the protein energy malnutrition. On protein energy malnutrition, you may get the short note also or the long questions also. So major health and nutritional problem in India, it is important cause of child morbidity and mortality. So also leads to the permanent impairment of the physical and mental growth. So if you doesn't have enough protein in the child's diet, child may get physically derangement also the mental development is also very low or in a slow progress. So marasmus, that is severe malnutrition is called as the marasmus. So caused by the deficiency of protein and energy both. So deficiency of energy from other two main nutrients, that is carbohydrate and fat also there, and also the protein energy malnutrition, that is protein deficiency is also there. So it may result in the loss of fat and the muscle mass. So body appear very thin, okay? So muscles are very flabby, okay? And there is not even a mass also there, okay? So it also includes deficiency of many micronutrients. So usually what happens, protein is required for the metabolism of many vitamins, minerals also the carbohydrate metabolism also. So if you are having a protein energy malnutrition or the protein deficiency, the deficiency of micronutrients like vitamin A, vitamin D, vitamin C is also there. So there is deficiency of these micronutrients also. So along with the protein energy malnutrition signs and symptoms, children may appear with the signs and symptoms of the vitamin deficiencies. So Kwashiorkor, that is the condition due to the deficiency of purely protein. So severe deficiency leads to the fluid retention and makes stomach looks like a clotted. So usually child looks like a very thin hands and chest and legs, but the abdomen is very bloated or it may be like a balloon shape. Okay. So these are the comparisons between the marasmus and the Kwashiorkor signs. First, muscle wasting. Yes, in marasmus there is obvious muscle wasting, and in Kwashiorkor sometimes hidden by the edema or the fat. Okay, because in marasmus fat loss is also there, but in Kwashiorkor signs there is edema, that is accumulation of the water over the joints or the other part of the body. So there is muscle wasting is hidden by the edema and fat. So fat loss, severe fat loss, that is severe subcutaneous fat loss size, there is no fat loss. So edema, in marasmus, no edema present, but in the Korsakoff side, usually present on the lower lips and the arms and the face. So moon face like consistency is there, that is child appear with the swelling under the eyes, over the cheeks, or it's like a round moonish shaped face. So weight for the height is very low in marasmus and the weight for the height is sometimes low in the Korsakoff. Face looks like a monkey's face, here the moon face. Mental changes sometimes quite an apathetic, and in the Korsakoff there are very rare mental changes. Appetite is usually good and in Korsakoff appetite is very poor. But this appetite may be for other fast food or the other things is there because child doesn't want to eat any nutritious food. So diarrhea is often present in marasmus and Korsakoff also. Skin changes, there are usually wrinkled skin. Like if you are testing the skin like this, it shows the wrinkle by going down. So this is the sign of healthy skin. But in a child, what happens if you pull up the skin and it goes down, it's like a wrinkle. Okay. So diffuse pigmentations are there in a Korsakoff or sometimes flaky pain and dermatitis. So hair changes are usually not there in a marasmus, but in the Korsakoff side there are silky, easily pulled up or the brownish color hairs are there. So liver enlargement is not there in the marasmus, but sometimes present due to the accumulation of fat. Liver derangement is seen in the Korsakoff signs. So how the management is done? By the nurse, there's also and by the dietitian also. Okay, according to the diet management, we have the three phases. First, stabilization phase, transition phase and rehabilitative stage. Okay, phase. So stabilization. Usually children without adequate appetite or the major medical complication are stabilized in inpatient department. So if you are looking any signs and symptoms of the protein energy malnutrition which are severe in condition, if you are seeing diarrhea in more often or the skin changes are more often and if you are seeing edema in more often, so you have to give a treatment in a IPD. Okay? So start diet used as a feeding formula which promotes recovery of the normal appetite. See what happens, appetite is very low. So child cannot eat anything from their household recipes. So you have to start the formula feed or the any protein or the supplementations like meal replacements. So you have to start with it. So you can balance their normal electrolyte balance, also the metabolic functions. So monitor the signs, but while feeding the child, you have to watch for the overfeeding also the overhydration also. So transition phase, if child is tolerating feeding, then increase the intake of energy and protein. If child starts to tolerate the feeding like in a clear liquid or full liquid diet, you have to include the new innovative recipes in their diet which are protein rich and which are also energy rich. Like whatever dal khichdi is there with the ghee. Okay, so ghee can give the good fat also and dal khichdi gives the good amount of complete protein also. Some other recipes like paneer or sometimes the high protein rich chole or soya beans. So the fruits and vegetables you have to include. So return on the appetite is seen in this condition, and also aim is to reduce the edema. So electrolyte balance or the protein intake is given more in amount to reduce the edema. So usually the protein intake in this child is weight multiplied by 1. So what if the child's weight is 13 gram, so 13 kg, so you have to include 13 multiplied by 10, that is 13 gram protein in his diet. So rehabilitation phase, the aim is to promote rapid weight gain. What happens? The now child is very stable, he has returned his appetite, so you have to include the recipes which can give him the weight gain. So you have to achieve the weight up to his proper height. According to the height, you have to. There are some ratios that if child's height is this much, then weight should be this much. That protocol should be followed, and you have to gain the weight up to that normal stage. So stimulates the emotional and physical development and prepare the child for the normal feeding at home. So you have to prepare child for the normal feeding at home. So in this stage, you have to give a proper diet chart which can mother follow and okay, उसके मदर में उसके लिए बनाना चाहिए, इजीली प्रिपेयर्ड हो, ऐसा डाइट चार्ट उनको घर पे जाते टाइम पे देना चाहिए, राइट? Then second is the gastrointestinal diseases. When managing diarrhea in the children, the priority is preventing the dehydration. So here, diarrhea means what happens? There are more fluid loss. So there is more fluid loss. So you have to achieve you have to prioritize the dehydration and giving the food that are gentle to the stomach. So whatever the food you are giving can उसके डायरिया के सिम्टम्स एग्रीवेट नहीं करने चाहिए, उल्टा वो स्टेबलाइज करने चाहिए, उसके स्टमक के लिए वो प्रॉपर होने चाहिए, ओके? सो हाइड्रोलाइज होने चाहिए या फिर वो डाइजेस्ट हो जाए अच्छे से, ऐसे होने चाहिए. सो हियर child safe anti-diarrhea diet is there. First the dehydration first. So oral dehydration solutions, that is ORS, must be given, like Pedialyte or the WHO recommended formula to prepare the fluid loss and the electrolytes. So avoid avoid sugary and milky juices because milk activates the diarrhea. Also sugar gives you more concentrated diarrhea-like symptoms. And soda and cold drinks. Okay, usually what happens in IPD is if baby having diarrhea or the gastrointestinal stomach ache or the issues, then usually mother or father prefer the sugary drinks, like I don't want to give the brand name, but the orange juices or the mango juices are there. So usually that activates the baby's symptoms. Not exactly diarrhea, but the pain in abdomen is aggravated by this sugary kind of things. So they can worsen the diarrhea due to the high sugar content. Then often frequent small sips of water of ORS, especially after each use stools, has to be given. What happens? Baby cannot drink directly 1 glass of water. So you have to include it sip by sip. Or target should be the 50 ml every time whenever he is taking. So small quantities, small intervals must be preferred. Okay. So anti-diarrheal food, so it includes usually once the child is hydrated and keep food down, start with the bland food. So it must not be bland, means not non-spicy. Okay, there is no any masalas there, no chili powder is there, no any oily content is there. So it must be bland with only the salt or the any small spices like jeera and dhania is enough. So good choices are banana, rice, boiled potato, sweet potato. So why all the starchy food is there? See, banana is starchy, complex carbohydrate, rice, boiled potato and sweet potatoes are also the complex carbohydrate sources. So why? So prebiotics and probiotic concept is there. So probiotics are the living organisms, often bacteria, that when consumed can benefit the host or they are the good bacteria which are found in some foods like yogurt, buttermilk. Okay, so that enhances the stabilization of your stomach or the gut and reduces the diarrhea. So probiotics are usually food ingredients. This is the probiotics. Then prebiotics are the food ingredients that selectively stimulates the growth or activity of these probiotics. Okay, so probiotics are dependent on the prebiotics, and these probiotics helps to reduce the diarrhea, also the healthy gut, that is healthy gastrointestinal system. So these prebiotics are found in a probiotic, like those found in the probiotics are complex carbohydrate foods. So these are banana, rice, potatoes, wheat are the prebiotics, and the yogurt, buttermilk are the probiotics. So whenever you want to give a curd or buttermilk to the child, in this previous list 2 hours, so this is not given in any book, this is the dietitian's experience, that if you want to give buttermilk or the yogurt in a diarrhea, so उससे पहले 2 घंटे पहले you have to give banana or the rice or the sweet potatoes, boiled sweet potatoes. Okay, so that probiotics can easily give their energy from the prebiotics. Okay, so food must be dairy products like milk or the other milk products like the paneer वगैरह, but yogurt and buttermilk is okay for children. Then fried and greasy food, sweet candy and chocolates, high fiber food like the raw fruits and vegetables, but you can give it in a steam formula. Okay, but banana you can give because it is rich in a potassium, so it helps in the recovery of the electrolyte imbalance also. Also it is a complex carbohydrate, so can be used as the prebiotic. Then acidic fruits and juices, then sugary or artificial sweetened drinks. So that must be avoided. Nowadays major problem is the juvenile diabetes. Okay, so what is juvenile diabetes? So it is referred to the child or adolescent with type 1 diabetes. So it is found usually in a child also, adolescents also. So it is not like the born with the diabetes. It can be found or the वो कब डायग्नोस होता है, जब तक चाइल्ड एडोलेसेंस में आ जाए तब तक वो डायग्नोस हो जाता है. So this is usually the type 1 diabetes which has the deficiency of the insulin. Okay, तो इंसुलिन इस प्रिपेयर नहीं हो रहा था उस बेबी के इसमें या फिर एडोलेसेंस में. Okay, so it requires a careful planned diet and helps to manage the blood sugar level. So consistent carbohydrates should be there. So we are not going deeply into the signs and symptoms because the only dietary management is the main questions coming in the exam. So what are the dietary managements? So consistent carbohydrates. So you have to include the carbohydrate in each meal because child is in a growing age. He needs carbohydrates for the development also, for his mental stability also, or daily functions also. So don't restrict it, just divide it in a 4-meal pattern or the 5 or 6 meal pattern. Okay. Then use carb counting. So whatever the carbohydrate, for example, if child requires 300 gram of carbohydrate in a day, so whatever he is eating, just start to calculate the carbohydrate of it. So that is carb counting. So to match the insulin doses. So what happens? Insulin secretion or the insulin doses are according to the carbohydrate intake. There is 1:10 ratio is there. Every 1 unit of insulin required 10 gram of carbohydrate. So you have to match it. So carb counting must be बच्चे को और उसके पेरेंट्स को वो कार्ब काउंटिंग सिखाना पड़ता है कैसे करना है. ओके, देन प्रेफर कॉम्प्लेक्स कार्बोहाइड्रेट फूड्स लाइक इज ग्रेन्स, वेजिटेबल्स, फ्रूट्स और द रूट वेजिटेबल्स आल्सो एंड ओवर द सिंपल शुगर. सो शुगरी कंटेंट से अच्छा बेटर है कि आप कॉम्प्लेक्स कार्बोहाइड्रेट पॉलीसैकेराइड्स ज्यादा दें. ओके, सो बैलेंस मील. ईच मील शुड इंक्लूड कार्बोहाइड्रेट्स फ्रॉम होल ग्रेन, फ्रूट्स, स्टार्च, वेजीज and the protein from the lean meat, eggs, beans and tofu, and healthy fats like seeds, nuts, olive oil, avocado, also the ghee. Okay, for Indian diet include ghee in the child's diet. Okay, so low glycemic index or the foods must be included. So what is low glycemic index food? Low glycemic index, for example, if you are eating a sugarcane juice in your diet, within a 1 hour it increases the spike of the blood sugar level. So its glycemic index is very high. But if you are including a high fiber food in your diet like carrots, cucumber, that is salads, so it gives the very less sugar spike in your diet. So this is the glycemic index. It is the capacity of that food for increasing the blood sugar level immediately after eating. Okay, उस फूड की कैपेसिटी है जो आपका इमीडिएट शुगर लेवल इंक्रीज करता है. कितना इंक्रीज करता है, लेस और बिग, दैट इज द ग्लाइसेमिक इंडेक्स ऑफ दैट फूड. ओके, सो लो ग्लाइसेमिक इंडेक्स फूड यूजुअली आर कॉम्प्लेक्स कार्बोहाइड्रेट्स. ओके, और द सीड्स और नट्स. ओके, सम फ्रूट्स हैज वेरी हाई ग्लाइसेमिक इंडेक्स लाइक चीकू, सीताफल, देन ग्रेप्स and ripe banana, ripe papaya have high glycemic index, but some fruits have very low glycemic index. That is, some of them are guava, then muskmelons, then oranges, sweet limes have very low glycemic index. So according to this glycemic index, you have to put the food in that child's diet. So avoid high glycemic food like wheat bread, candy and soda, and choose food which is food that release sugar slowly like oatmeal, legumes and apple. So usually gehu, then ragi, bajra, then other millets, also the pulses like moong dal, chawri, chole, rajma has a very low glycemic index. So you have to include pulses, legumes and the cereals in that child's diet. Okay. Then regular meal time should be considered. Whatever the first three options are, first points are consistent carbohydrate, balanced meal, low glycemic index. Fourth point is the regular meal time. So in an elder diabetes, like diabetes 2, sometimes people only have to give a insulin for the 2 times. So they are like just only 2 times meal is sufficient. But in child's case, they need energy for growth also, for their daily activity also, because the child's daily activity is more than the adults. So for this needed extra activities, you have to include the small and regular meal. So this meal should be at a 4-time interval or a regular time. Okay. So avoid skipping the meals because that may cause the hypoglycemia or the ketoacidosis. So child can land up into the ICU. Okay. So healthy snacks should be included. So it's not like the every 4 meal मध्ये तुम्ही चपातीच दिली पाहिजे किंवा भातच दिला पाहिजे. It's not like that. You have to include in between snacks in 2 big meals. So ideal snacks should be the low-fat cheese, nuts, yogurts, fruits and nut butter. Always pair carbohydrate with the protein or a fat to slow sugar absorption. Okay. So this is one trick that you have to reduce the glycemic index of specific food. You have to include a ghee in it. For example, we cannot avoid rice in a child's case, but just include a 1 tsp of ghee over a rice can reduce the glycemic index of the rice. Okay. Then hydration. Drink water throughout the day. Limit sugary drinks and fruit juices. Limit processed food. So this is the main culprit for the juvenile diabetes. Okay. So you have to minimize the candy, chips, cookies and sugary cereals from your, or you have to directly omit it from your diet. Okay. Then childhood obesity. Okay. So childhood obesity, it is one of the major growing global epidemic and requires our attention. Usually signs and symptoms, all you know, that is a high BMI, appearance such as the stretch mark, dark velvety skin around the neck, and it may land up into the diabetes also, that is type 2 diabetes in a child. Okay. So eating disorder is the main cause for it, and the complications are cardiovascular diseases, gallbladder diseases, or the osteoarthritis changes in a children. So this is the main thing to look into for the dietary management. So usually dietary management includes the increase the physical activity also and the diet also, proper balanced diet also. So increase the intake of fruits and vegetables, it reduces the intake of food containing high fat and high sugar. What happens, childs nowadays are usually depend upon the fast food and the packaged food and ready to eat food which has the high triglyceride level, high saturated fat level. So just replace that saturated fat with the good fat, that is monosaturated and polyunsaturated fat. Monounsaturated and polyunsaturated fat. So increase the physical activity. Just avoid to watch the TV while eating, because this watching the TV while eating, the child doesn't know how much he eats. So there must be binge eating while watching TV. So also the watching media while eating should be reduced. Sugar is a new tobacco. Okay, so intake of sugar must be limited. So whatever the sugary things you have to identify from the child's diet, that is the soft drinks also there, some of the ready to eat powder formulas are there like Tang or the other things. So they also have the high sugar content. Some candies, chocolates are there. Even also some kind of foods which are ready to prepare also has the sugar content in it more. So decrease that sugary content, increase the complex carbohydrate and water intake, Okay, usually normal water intake or the infused water intake must reduce the helps to reduce the weight. So increase the complex carbohydrate, that is the salads must be more there, and protein is according to the weight, that is weight multiplied by 1, and reduce the fast and ready to eat food. Okay, like Maggi or the ready to eat pastas are there, ready to eat curries are there, so it must be reduced. Okay, then next is the anemia in adolescence girl. So usually seen in between the 12 to 15 years, that is the age of the puberty. So the main cause is the nutritional deficiency also, and the second cause is the starting of the periods or the menstrual cycle. So high risk is due to the accelerated increased demand of the iron. Okay, so poor dietary habits are also there. Worm infestation is also one of the cause for it. Also the physiological changes like puberty, pregnancy and lactation. So are because the high demand is required in adolescence for the next physiological changes. So you have to achieve that iron demand. Okay, so intervention must be administration OD, that is once in a day, supervised weekly iron and folic acid. So folic acid supplementation are must in this case. Then deworming must be needed. Then increase the intake of iron rich food and the vitamin C food. That is vitamin C helps in absorption of iron. That's why vitamin C also included in the diet. For example, you have to keep one small lemon in your diet, or you have to just squeeze it on your dal khichdi or the rice. Okay. So iron rich food includes moringa, that is drumstick also there. Then peanut lassus, khajur, then dates are there, and some green leafy vegetables, some fruits like anjeer, pomegranate are there. So you have to include it in child's diet. Then deficiency diseases are there. Usually what happens, anemia is not only depend upon the iron deficiency, it depends upon the vitamin B12, other vitamin B complexes deficiency also there. So you have to include that kind of food which is rich in the vitamin B complex in that child's diet. So usually vitamin A deficiency is night blindness or the thalassemia. So include the vitamin A fortified milk, some cereals, egg yolk, liver, fish liver, and green leafy vegetables, yellow and orange fruits and vegetables. Okay. In vitamin A deficiency, vitamin D deficiency causes the rickets in the children, that is soft deformed bone development. So the slow formation of teeth, in chest, or the delayed milestone. Okay. So prevention is vitamin D supplementation or the sun exposure, also the calcium and phosphate supplementation, fish intake and mushroom for the vegetarians. Okay. So vitamin K deficiency can cause the inadequate blood clotting. So prevention is usually supplementation in active condition and green leafy vegetables in regular diet. So these are the profile for the vitamin B complex, but usually for all these deficiencies you have to include more fruits, green leafy vegetables in your diet. Okay. So mineral deficiencies, iron, anemia, we considered it. Second, iodine deficiency. Iodine deficiency has the risk of miscarriages also the goiter, that is due to the hypothyroidism. So management is iodine rich salt is only the one management there. Then calcium, hypocalcemia can cause the convergence in the children, confusion, also the slow development, muscle cramps, soft bones, brittleness. So intervention must be calcium rich food, that is sesame seeds, rajgira, ragi, bajra, also drums